Hey everyone, myself Dr. Amit. I am JR in the Department of Radiodiagnosis at AIIMS Hyderabad, and today I will going to present a case on Phyllodes tumors. So here there is 40-year-old female came to surgery OPD, presented with lump in the breast since 6 months, and she is having intermittent pain since left breast for 2 to 3 months. The patient was apparently alright 6 months back, and then she was started complaints of lump in the left breast since last 6 months, which was initially smaller in size and increased in size and attained the present size over 6 months. The swelling occasionally associated with pain, which is dull aching type, and pain increases during sitting or standing for a long time. There is no history of radiation of pain, and pain is relieved by taking medications. Now, patient referred to a department for radiological investigations, and we did USG scan on dated 17 December 2022, and here we have the USG scan images. So here we can see that this is large irregular heterogeneous lesion showing internal rounded cystic areas involving the entire left central breast. The margins of the lesion with adjacent parenchyma appears well defined and appears to extend up to the level of nipples. There is increased vascularity noted within the lesion. Here we can see that the vascularity, and then we put our power Doppler and there is low resistance waveform. Look over here. Here we have the low resistance waveform and the resistive index is 0.4. So the resistive index is 0.4. That means there is a low resistance waveform. Now we can see that there are few specks of calcification is noted, and we also noted that there was increased peripheral vascularity. So increased peripheral vascularity noted, and when we look for the axillary lymphadenopathy, we found that there are few lymph nodes with lobulated contour and preserved fatty hilum. So it is looking like benign only. So there are few well-defined lymph node noted in the left axilla. Largest one was 18 into 10 mm, but yes, with preserved fatty hilum. There are also few lymph noted on the right axilla too, and they are having the short axis diameter is about 6 mm. So all are benign only. After this finding, our impression was these all features are suggestive of Phyllodes tumor involving the left central breast, and there are left axillary lymphadenopathy noted with preserved fatty hilum. So likely it is benign. And the lesion was considered into the BIRADS 4 category. BIRADS means Breast Imaging Reporting and Data System. It is designed to standardize the best imaging and reporting and to reduce the confusion in breast imaging interpretations. So this is the BIRADS. And the patient was managed by surgical excision of the breast lesion, and here we have the image of surgical specimen. Now let's talk about the literature review. So phylloid tumor are neoplasm accounting for less than 1% of the breast lesions. With increased breast awareness and screening programs, small phylloid tumor are being detected. In symptomatic breast clinics, including the institutions, triple assessment consisting an initial physical examination, followed by radiological imaging, that is ultrasound or by mammography, and at the end histological sampling either by fine needle aspiration cytology or core biopsy is the standard diagnostic pathway for palpable breast lesions. The purpose of triple assessment is to provide a more accurate pre-operative diagnosis to ensure proper surgical planning and avoiding re-excision of tumor recurrence. Now let's talk about some important findings in mammography. So typically seen as non-specific large rounded oval or lobulated, generally it is well circumscribed, look over here, and lesion with smooth margins. There may be radiolucent halo present and calcifications may be seen in a very small proportions. So these are the findings can be seen in the mammography. Treatment and prognosis of the phylloid tumor. Treatment is usually with surgical excision. Large tumors even required a full mastectomy. Both benign and malignant phylloid tumors have a tendency to reoccur if not widely excised. After wide local excision, there is relatively frequent local recurrence. It is up to 25% and up to 10% can metastatize. The mode of metastasis in such cases is hematogenous route. So this is about the treatment and prognosis part of the phylloid tumor. So these are the references I used, and thanks for watching this video. Stay tuned for the next one.